Hello, welcome to another Career Closeup. Today we have Dr. Zachary Walker. Hello, Dr. Zachary Walker. Dr. Walker is a board certified physician specializing in reproductive endocrinology and infertility. Dr. Walker attended Indiana University. Well, for undergrad, Dr. Walker went to FAMU. For medical school, he attended Indiana University School of Medicine. He completed
Mhm.
his residency at the University of Alabama at Birmingham, and he finished his training or is currently training at Brigham Women's Hospital in Boston, Massachusetts. Is that correct?
Yeah, so I did my fellowship here at Brigham and Women's Hospital, left for a little bit to private practice, and then came back to be at Brigham, in which I'm here now. So it's been about a year since I've been back.
Okay, awesome. Well, Dr. Walker is also a really active member of ASRM, including membership with the Society of Reproductive Endocrinology and Infertility, the SREI. He is on the DEI committee, and also he does work with the LGBTQ Special Interest Group. So we are super grateful to have you as a part of our organization and for all the great things you do. And we're so happy to talk to you today.
Awesome. Happy to be here. Thank you so much.
Yeah. Okay. So let's jump into your career. What initially drew you to the field of reproductive medicine? And did you envision this specific role early in your career?
So yeah, my story was that REI was somewhat of a hidden gem that I did not know about. I didn't get much exposure in medical school besides assisting with the tubal reversal. And that experience didn't go like super great. It was a very long procedure. So I was like, yeah, I don't think this is for me. So I entered my OBGYN residency thinking I would do high risk obstetrics. And pretty much held that true until my last rotation of my intern year that I did my rotation at REI, and I just fell in love with it actually. From the patients that I was seeing, the research being done, the advocacy work, and also seeing how well it brought me back to the roots of why I went into science. I did my major in molecular biology, and a lot of what we do in IVF is about molecular biology, what's going on inside, eggs, sperm, embryos, and genetics. So when found all of that out about the field, I started focusing more about RAI and did another rotation my third year, also did an away rotation, and it just always held true that it was always interesting and something I wanted to continue to do. And that brought me to the field here now.
Okay, so you loved the science of it, and it sort of matched well with the reality of the patients and just the experience that you were having.
Correct. Yeah.
Huh. Okay, so was there ever a pivot or detour or an unexpected opportunity or thing that happened in your career?
Yeah, I would say one kind of pivot was, COVID hit when during my third year of residency, and I was really panicked about if I would, what happened with fellowship interviews, would I be able to still apply, or what would change in terms of my career? And Zoom became the primary source for interviews, and I was able to still interview at a bunch of different places and also meet a bunch of cool fellows in the interview trail that I'm still very close friends with. So I, at some point, thought that I would be a generalist for a little bit. Looking even further back, prior to even applying to medical school, I thought I was going to do a graduate school and get my PhD because I was really an undergrad really into science, lab research, bench work. And I did a lot of summers at Duke University doing some lab research. So I thought I was going to do a PhD. And then someone from Indiana University came by, Florida A&M, and talked about becoming a physician and a doctor and how you can marry both fields. And that's when my career also shifted to getting my MD and then going from there. So there were kind of two big, I would say, um, points in my career that I pivoted or changed my plan.
So talk to me about, because I've heard a few physicians and people in this field talk about just the uncertainty that comes with finding your specialty. How do you deal with, you know, going through so much work and not being sure where you're going to go or what you want to do?
That is so funny you ask, and I'm happy to hear that other people are feeling the same way.
Yeah, it's a common
So,
theme for you
uh,
guys.
so I feel a lot of physicians are type A people and always want to, excel, to be the best at what they're doing, and always figure out how to excel and what's the next step. So, in medical school, after you finish all of your book work and you start doing clerkships, you get exposure to all the different specialties, and everybody's trying someone like Harry Potter, which hat are you going to be like, which house are you going to be sorted into? And you're trying to find your people, and the encouragement or the excitement you have every day, getting up to see people and take care of patients. And my OBGYN like clerkship rotation was the the best one for me because I was happy to take care of patients, deliver babies, advocate for women's health, and then also when I was speaking with other residents and my mentors on my clerkship, we all had similar kind of mindsets and similar thoughts about how we wanted to be a physician. So I just found my people and felt at home during the clerkship. And to test that theory, I did an away rotation at Emory University to see is it just OBGYN in Indiana that I like or the actual field itself. And when I was doing my away rotation at Emory University, I still liked the field very much. So I knew that it was kind of the path for me. So definitely it is something that a lot of people do soul searching in medical school, and it's trying just to find the best, you know, atmosphere, patient population research that's going on that kind of fits best for you. And then you go forward with that, and hopefully you match well and that all works out. But there are definitely some people I know who had a change of career plan that like went for one career, started doing it at during residency, it wasn't a good fit and switched. And that's okay too, because at the end of the day, we're all people trying to figure out what we're going to do for the rest of our lives.
Yeah.
So I would say for my path, I always just like to test my theories by doing like away rotations or trying to combat it with a different scenario to see if it still fits. And all that, reaffirmed my joy in OBGYN and why I really wanted to keep with it.
Lovely. Huh.
Mhm.
So even for the type A planners, there's a certain amount of feeling that you have to be able to register to kind of make your way to where you're supposed to be.
Yeah, that's for me. And if
Yeah.
there's some other type A's that are even more type A than I would say myself.
True. It comes in
But that
there's levels.
that was my way of saying, we have a theory, let's test it. If it's
Yeah.
so true, then keep with it. And that's, this scientific process.
No, that's a good way to apply it, but it
Mhm.
has been a theme. Even I remember talking to Kat Wong. She was such a fun interview to do. But she really talked about when you find your people, you kind of know that you found your people. So
Right.
that's nice that you were able to test it and confirm, like, yes, these are indeed my people.
Yeah.
Um,
And when you're waking up early in the morning, like 4 a.m., 5 a.m. to see people, you don't want to go in for something you really don't like.
Valid. Well, okay, Dr. Walker, let's take a little bit of a pivot and tell me about your
Okay.
current role. What does a typical day or week look like for you?
Yeah. So now, as an academic RAI, my week looks a little bit different than what it was in private practice. So, right now, I'm pretty much operating as a reproductive surgeon at least once a week, either doing laparoscopic cases or hysteroscopic cases. And then the remainder of the week, I split between mentorship. I am the chair of our sub I clerkship rotation for medical students. I also, of course, clinic responsibilities throughout the week, and I have a transgender fertility preservation clinic for my advocacy for the LGBTQ population. I also do some work with our ultrasound kind of radiology department for HICOSI procedures, and we're expanding that to help teach other OBGYNs how to do that procedure and increase access to care for that technique. And then I have some time saved to do research. So helping our current fellows come up with research projects or doing my own research. So since being back for the past year, I'm starting to submit some things for IRB approvals to get some more research funded. But a majority of the time I'm, helping teach other fellows how to do research or medical students or residents how to do research, and going from there. So it is a lot of teaching, which I enjoy doing. And I still am able to do surgery, which is another passion of mine. Um, Comparing that to private practice, where I really loved the people I worked with. I didn't have that much time to do surgery compared to IVF stuff. And it was a different atmosphere in terms of Indiana compared to Massachusetts. But the teaching role wasn't as prevalent when I missed that. So that was a kind of a plug to come back to the academic side of medicine.
Would you say that that is something that speaks to you is to be able to teach and mentor and get into the academic side of things?
Yeah, that's one of my big joys. I really like to kind of talk to students and residents who may be interested in the field, and give them, a real world kind of a uh, summary or experience about RAI, especially as a Black gay physician. It is somewhat of a hard role to know or see people like me in the process because we don't have a lot of diversity in terms of RAI physicians in the field right now. And I think through the advocacy I've had personally, through the DEI committee, through also I'm the vice chair of our Health Disparities Special Interest Group with ASRM, and participated in another forum called Up Squad that we had with the DEI committee, um, and to really get my voice out and also, be a face to show that even diverse students, residents can be in this field, and patients are really looking for people like us that are diverse and may be able to kind of uh, feel more comfortable with the care they're receiving. So I really like to advocate for that when I'm teaching, but also just to be real with people, with other people I'm mentoring in terms of you don't have to be perfect to be able to do this specialty. Some people do have hiccups in terms of scoring, grades, but that's not the end all be all. So still supporting them and encouraging them to apply and stick with it. So I've seen some residents who have applied and didn't make it the first year and were reapplying and asking for advice and helping them, and they successfully matched like in subsequent years, and that's always exciting to share that joy with them when they find their home. And know that they're going to be part of the family, and I'll be able to work alongside them in the future. So those moments as a mentor have been a great joy for me.
Have you always been a leader?
I wouldn't say I've always been a leader. But I guess now looking back at it, I have had a lot of leadership roles. I don't know if it's either from merit or from um, me advocating for myself to be so. But I do think that I've had numerous leadership roles throughout my educational career, um, whether it be in music or science or in work. I tend to have some type of leadership role in some degree.
Yeah. Would you consider yourself to be a very vocal person?
Yeah, I'm definitely an extrovert. And if you ask any of my friends or colleagues, I definitely am more of a vocal person.
Yeah. It's nice to see that you've been able to translate that to not just like your work, but the additional advocacy and mentor and education. Because you don't have to do all those things, but you choose to. And I don't
Ex-
doubt you're tired.
No, that's so true. Some people talk about, being taxed with being the DEI person or the health disparities person or having to do things that other people may not feel comfortable with doing. But I recently just had a talk with some of our Harvard medical students about, my path in medicine and some of the hurdles that I kind of overcame during my process, and how that invigorated me to still be an advocate for those behind me to make the path hopefully easier for them. And I think that is something that brings me joy. It may not bring everybody in kind of the same diverse background I have the same amount of joy, but it's something that I feel passionate about and really want to help the people behind me or who are upcoming have an easier time and feel more comfortable about being their authentic selves and find the right fit for them.
Yeah, that's really encouraging and inspiring. One of another questions we have in the stockpile, what skills or
Mhm.
experiences are most essential to success in your position, especially ones that people might not expect?
I think other skills that are nice to have are, you know, in your workspace, making sure everybody that is working alongside you feels comfortable coming up to you, asking for advice or uh, how to take care of patients if it's not someone that you're responsible for on another team, but still a resource for information. So being able to work with other colleagues, other people in your practice, and being a warm environment to make sure everybody feels comfortable at your job is another skill set. So I think some people forget that and when we get further up in our career. But definitely. You want to make sure you're a person that is very approachable, as well as a mentor.
Lovely. Let's see. Can you share mm, a moment? Well, I think you already kind of did that affirm
Mhm.
that you were in the right career. And I was going to say some of your earlier comments about the people that you were around. Or go ahead and answer. Are there any moments that stand out that kind of affirm that?
Yeah, I would say the primary moment that really solidified REI was the right fit for me was when during my 3rd year, there was this conference at Reproductive Medicine Associates in New Jersey, or RMA New Jersey. They had this conference called the Pathways Conference where they brought a bunch of um, residents who were interested in RAI to their facility. And we did a little tour. We learned about the interview process. We did some mock interviews. But really, what brought me the most joy was getting to talk to other people interested in the same specialty and how similar we were in terms of our interests, our kind of personalities, and what we were all experiencing. It was like a whole new family I found at that conference. And I still talk to them pretty much every day now.
Wow.
We just finished our board. So it's like I have this whole new family that I'm going through my academic career with. And it's such a joy to have them. And that was the moment I knew, like, yeah, this is my group of people. I think this is who I want to stick with me through the rest of my career, and I would be happy with that. So
Yeah.
that was a pivotal moment where I knew that, yeah, this is a specialty for me.
Good. That's nice to hear. What are some of the biggest challenges that you faced in your role, and how have you worked or learned to overcome them?
Yeah, so I would say there are different facets of challenges, either
Yeah.
battling with the academic hierarchy of things, or just like the political stuff, or um, more
Mm,
technical things. But I would say I tend to um, focus on what processes are in play to make it easier for the next time or some another patient to have a better experience, or for it not to have that same um, hurdle or obstacle in the way. So, for example, right now, Massachusetts is really good at providing coverage for fertility. There's a fertility mandate, and this has definitely helped a lot of patients receive access to care. But the not every patient who has that mandate has coverage for treatment. So they can definitely get the diagnosis and know what's going on with their fertility, but not necessarily have the insurance to cover the treatment that is needed.
mm,
So it's working with them on other ways to help build their family, or looking for scholarships or grants or other protocols that can be used to help reduce the cost to them, which is the biggest obstacle, but also part of how this field is expanding and trying to provide access to care to everyone. So, you know, I can't complain as much as other physicians who are in different states that don't even have a mandate at all. But it is something that I continuously see every day in terms of how to help patients be able to achieve their goals. Um, so I don't know if I have like the best answer for that, but it's
yeah,
just more of it comes with the job day to day, just trying to figure out best plans for everyone.
yeah. It seems like working in the fertility space has always had some sort of social challenge attached to it, that changes, as time changes. And it seems like now the political landscape is one that, you guys really have to be able to maneuver, in order to do your jobs.
Exactly, and like what to say, what not to say in terms of what you can put on IRB approvals or research about, and how to, especially as doing a LGBTQ transgender fertility preservation clinic, some of the nuances there in terms of coverage for like fertility benefits versus if there's any research that we want to do in that field, would it be supported by any federal funding or would it only be local funding, things like that that can get in the way of being able to improve the field and expand access. So
Yeah.
um, that since it's a passion of mine, it's something I'm willing to continue to work on and try to make things better for our patients, but it's definitely a headache sometimes.
Yeah. Who do you lean on?
So definitely, I'm one of the 10 physicians we have here, and all of the physicians that I work with trained me. So I definitely lean on them for insight. So one of them is, Dr. Elizabeth Ginsburg, the past ASRM president. She's definitely a wealth of knowledge and
Yeah.
information on how to navigate at the kind of hierarchy of in academics as well as different protocols and plans to use. So I lean on her. Also lean on some of my colleagues in the MIGS department in terms of surgical consults or difficulties with surgery, as well as the mentors I have in the surgical Society of Reproductive Surgeons to get their input on things too. So I have a lot of mentors that I can definitely contact if I have questions or concerns, which is something I'm happy to have built over the time of my um, fellowship and residency.
Yeah.
So I think that's another key thing to do when people are going through their training is trying to build these long lasting relationships and up keep them up to date on your progress and success. So that's always the thing mentors really want to hear is how well you've improved or how far you've come. So um, it's nice to have those people in kind of my back pocket to lean on when I have difficult situations.
Yeah. I've heard a lot about how mentorship has just really propelled quite a few physicians, and it seems like a big deal, specifically, probably for every field, but the fertility field, you guys like community is so strong, and the mentorship seems
Yeah.
to last forever.
Yeah, and our field is so small, pretty much like everybody knows everybody. So if you don't know somebody, like if I have like a fellow or a student asking me a question I don't know, I have so many people I can lean on inside this institution or elsewhere, especially, you know, patients who may be traveling or moving,
Mm.
I can reach out to other fellows or people I know in different states to also help them continue their journey or provide them references or referrals. So
Yeah.
it is really nice to have that network. Um, I would also want to highlight, the mentors I have in terms of health disparities, racial disparity research, which have been somewhat of a breath of fresh air in this field since there's so few of us,
Mhm.
and going to like national conferences and meeting up with them and they always check in on you and kind of know the questions to ask
Yeah.
to really drive out like what's really going on with you. So it's nice
Yeah.
to have that as well. And we always try to have some type of meeting or social event during conferences so we can always check in on one another, and also how we can continue to um, keep the pipeline going for more diversity coming through the field so we can provide that care or that opportunity for future patients to have providers that may look like them
Yeah.
and be able to take care of them.
Well, looking ahead, where do you see your career going next? What would you love to see in the next 5, 10, 15 years?
That's a good question. And every time I think about it at all, it continues to change. To be honest, I would say one of my goals in general for my career path is to be involved with um, fellowship programs. So potentially down the road, being um, a part as like a fellowship director or associate fellowship director, or being a part of more national committees within ASRM, and being more involved in that way. So I'm looking to definitely expand my voice and my advocacy for patients, and I think those are the two biggest things that would be the next steps for me in terms of long-term goals. Um, but yeah, we'll see what comes.
Yeah, I love that. So if there's anyone who's watching who wants to like reach out, where can they find you?
Yeah, so definitely, you can always like reach me via my email,
I'll include
or which
that.
is on my ASRM website, I believe. But it's zwalker1 at bwh.harvard.edu. Um, And outside of that, if you see me at a conference, feel free to come up and say hi or talk. I'm really definitely a people person. Reach out to me on our Health Disparities SIG platform. ASRM has the discussion boards and ways to network on that too. So if you are looking to join a committee or a special interest group, definitely recommend the Health Disparities one. And you can reach out to us and network through that way too.
Excellent. Thank you for making yourself available for us. And I know that there's someone who's going to get something out of this conversation.